Hi, my name is Dr. Oded Volovelsky. I'm the head of the Pediatric Nephrology Unit and Research Lab at Hadassah Hebrew University in Jerusalem, Israel. I would like to present to you a short overview on our study on tuberous sclerosis complex disease that was published lately in Journal of JCI Insight. Tuberous sclerosis complex disease is caused by a mutation in either TSC1 or TSC2 gene. This mutation leads to hyperactivation of mTOR complex 1. The disease involves different organs in the body, mainly the brain and the kidney. The kidney disease includes angiomyolipoma, a benign vascular lesions that can have dangerous bleeding, and a cystic kidney disease. In adult patients with TSC, there is high incidence of chronic kidney disease. One of the reasons is that the cyst leads to gradual loss of renal parenchyma. The purpose of our study was to understand the pathomechanism and identify therapeutic targets of TSC cystic kidney disease. For that purpose, we use a mouse model in which the embryo have a complete deletion of TSC1 gene in nephron progenitor cells. These cells will eventually differentiate into the nephron, the basic functional unit of the kidney. We found that the damage can be identified already in an embryonic age of 15.5 in tubular structures in the kidney. The damage was mainly in proximal tubular cells and was marked with hyperactivation of mTOR complex 1 as demonstrated over here by high level of phosphorylated S6. In order to control the mTOR complex 1 activation, we injected rapamycin, an mTOR inhibitor, throughout the pregnancy and removed the kidney after birth. We found that the cystic kidney disease has improved significantly in the pups after an injection was previously done to the mother. We found that not only there is a significant improvement in the mTOR complex 1 activation, but there is also a decline in other cystogenic pathways like c-MYC that was previously demonstrated in ADPKD disease. We demonstrated that injection of rapamycin throughout pregnancy leads to improved survival of the TSC offspring. While the rapamycin group survived for about 2 weeks, the control group died after a day or two. We then investigated what's going on in the proximal tubular cells, and we found hyperactivation of pathways that are related to inflammation. These results were validated by real-time PCR. We found that the inflammatory infiltrate inside the kidney was mainly composed of macrophages marked by F480. Injection of corticosteroid dexamethasone throughout the pregnancy and a strong anti-inflammatory agent led to an improvement in the inflammatory disease and improvement in the cystic kidney disease in offspring. Not only that there was a significant improvement in the inflammatory process, but also there was an improvement in the mTOR complex 1 activation. So, based on our findings, we suggest that rapamycin and corticosteroids injected to mothers who carry TSC embryos leads to an improvement in the cystic kidney disease by control of mTOR complex 1 activity and other cystogenic pathways in the kidney. I would like to thank my team that is led by Dr. Morris Nechama, and also to Dr. Elad Reznik from the Department of Pediatrics, to Dr. Karen Meir from the Division of Pathology, and our PhD student, Mr. Yaniv Mekayes. I would also like to thank the Israel Science Foundation for the support. Thank you very much.